I'd like to introduce you to the team that oversees the Conexiones Positivas program here at AIDS United. First, I'd like to show a photo and welcome my dear colleague Obrinka Thompson-Claiborne, who is based in Birmingham, Alabama, and she's our program manager. My name is Christopher Cuevas, and I'm Senior Program Manager. I use they, ella pronouns, and I'm based in Washington, D.C. And together we make up the team that will be your direct support for the program and for both of the funding opportunities that fall under the Conexiones Positivas program. For those that are not familiar, AIDS United is one of the largest HIV advocacy and philanthropic organizations in the United States. Our mission is to end the HIV epidemic here in the US, and we believe that in order to do that, we have to work collaboratively across all sectors. And so our vision is the achievement of ending the epidemic. And what we mean by that is when all people, governments, and organizations commit to ending the epidemic, we are collectively investing in the health, well-being, and the human rights of all of those who are impacted by HIV, including those living with and those affected by the epidemic. Here at the Conexiones Positivas program, we take that a step further by specifically focusing in on the impacts of the epidemic among Latina communities. And we do this through a couple of different avenues. First, we invest in our strategic grant making, which is something that we'll cover today. Then we provide capacity building opportunities for organizational and individual leadership development. We engage in public policy and advocacy work as an institution, and we directly resource organizations engaged in such efforts. We have strategic communication campaigns that aim to address cultural stigma and that aim to provide access and opportunity for individuals living with and affected by HIV in English and in Spanish. And we invest in original research to demonstrate impact and to show the impacts of the epidemic in the long term as it continues to be a pervasive epidemic among Latina communities that gets very little attention from the mainstream. A little bit about the Conexiones Positivas program, first launched in 2020 by AIDS United and supported by ViiV Healthcare's Positive Action Grant Program. We're really dedicated to uplifting and investing in the health and well-being of Latinas across the United States. And again, as I said, we do this through these different avenues. We also invest in the next generation of leaders through our Caminos Fellowship Program, which I'll speak a little bit about later on. This year, for the 2024 grant-making cycle, we have $125,000 available in funding. And we anticipate making grants for a small cohort of organizations that are directly led by and serving Latina communities living with and affected by HIV. And this opportunity is not limited to organizations that exclusively work in the HIV sector. We are also invested in supporting organizations who are part of broad social justice movements and coalitions to invite them into this work, because we recognize that in order to end the epidemic, we must be in solidarity across all movements, because all of our community is affected by the epidemic. The goals of the Conexiones Positivas program are to invest in organizations that provide HIV care, prevention, advocacy, and leadership development, foster these collaborations with organizations who have traditionally focused on HIV and those who are engaged in broader social justice and civil rights efforts, and to increase the resources of Latina communities nationwide through grant making and capacity building. As I said, this year we have $125,000 available to offer in grants, and that will be for the next 3 years. Our funding available through our programs is 12 months in length and is renewable annually. And the funding that we provide through this program is exclusively for general operating costs, so that we can support organizations in achieving the work that they need to do to meet their mission while focusing on one of the 4 key areas that the Conexiones Positivas program has set as our funding priorities. And we'll go over those funding priorities a little bit later in the presentation. So as I said, we have 2 funding opportunities that are present for the Conexiones Positivas Fund. The first is a fund called the Caminos Fund, which is available for organizations with an operating budget of less than $300,000 and will award $30,000 across 3 years. In addition to this grant, Organizations who are recipients of the Caminos Fund will also be provided with $15,000 spread across 3 years to support 3 individuals within their organization or their network to provide 12-month leadership development program. These funds will be used to cover a stipend for their participation, as well as any other professional development learning costs that are associated with the program. We believe that it is paramount for us to invest in the next generation of leaders who will continue to carry the mission and the movement forward so that we can end the epidemic. Organizations with budgets under $750,000 but above $300,000, we are providing $75,000 across 3 years. And we believe that this is a pivotal moment for many organizations in their life cycle, because this is often the period where organizations are able to jump just over the precipice to access larger, more sustainable funding from larger institutions, and many of which AIDS United receives direct resources from in order to re-grant out to communities. And so we are invested in supporting organizations who are ready to advance their efforts and scale up their impact in their communities so that they can access larger sustainable funding so that they can continue to make significant strides in their communities, locally, statewide, or nationally. Now, to give a little bit of perspective as to why we are running the Conexiones Positivas program and providing these grant opportunities. First, we want to clearly demonstrate that there is a paramount impact of HIV, pervasive impact, among Latina communities. As of 2022, 316,000 Latinas in the United States were living with HIV. And while overall incidence across the United States from 2018 to 2022 has seen a significant decrease of about 12%, Latina communities, as we see demonstrated by the graphs on the screen, Latina communities have experienced stagnation in HIV data since that time. And if we scale back from 2012 to 2022, we've actually seen a pretty significant increase in HIV acquisition among Latinas. But again, a pervasive issue that is often invisibilized in the broader conversations as it relates to HIV and health equity. And as demonstrated in the next few graphs, you'll see that these rates since 2018 have remained relatively the same. And if you account for data back from 2012 or even 2010, you'll see that there has been a pretty large uptake in the number of individuals who have acquired HIV since that time. According to data provided by the CDC, Latina individuals who identify as female account for 19% of new HIV diagnosis among all women, as demonstrated by the graph here. And many of these transmissions are accounted through heterosexual sexual contact, as well as injection drug use. Again, another segment of the Latina community that has little attention paid to, but is continuing to see an uptick in HIV transmission rates. In 2022, Latina gay, bisexual, and other men who have male sexual partners accounted for 89% of new HIV diagnosis among all men, as demonstrated by the graphs here. And this is for the first time pretty staggering data, because for the first time, this population represents the highest share of HIV diagnosis among gay and bisexual men. Overall, Latina people have experienced a 17% increase in HIV diagnosis from 2018 to 2022. Now, I don't have to further sound the alarm, but we are clearly seeing a pervasive epidemic that requires all hands on deck to be able to adequately respond to. These graphs just further illuminate some of the key data points that I just shared. Additionally, according to the Centers for Disease Control and Prevention, transgender Latina women transgender men, and transgender folks of expansive gender identity, including non-binary, genderqueer, and two-spirit folks, account for significant percentages of HIV diagnosis as of 2022, with transgender Latina women accounting for 39%, transgender men accounting for 25%, and gender non-conforming, gender expansive communities accounting for 32% of the communities who represent gender identities outside of traditional cis men and cis women. At the Conexiones Positivas Fund, we will support organizations nationwide who are doing critical work to address the epidemic. But based on the relevant data that's been provided by the CDC, we have identified 9 jurisdictions across the US and Puerto Rico that are going to be priorities for us. And so we encourage organizations based in these locales to submit proposals or to collaborate with groups if they have a broader regional reach, to collaborate with groups within these regions. Because these are the areas where we're seeing the highest incidence and the fastest rates of acquisition. So these 9 jurisdictions are Arizona, California, Florida, Georgia, Illinois, New Jersey, New York, Texas, and Puerto Rico. Again, this information available in Spanish as well. Now, with the application, we have a few series of information that we'll cover today. Now that we've sort of laid the foundation and have a greater understanding as to the urgency of the moment and why we have this funding opportunity present, I'm going to invite those on the call, if you have a moment today, to go and check out the request for proposal on the AIDS United website. You can find this by visiting aidsunited.org and clicking on our grants page, or visiting our news and resources section, where you'll see our announcement for funding. In today's session, we'll cover the request for proposals. We'll walk through the application itself. We'll talk a little bit about the technical assistance that's available as well. So to begin, all organizations who are going to seek for funding through either lines of funding under the Conexiones Positivas Fund must first go through an eligibility screening. And this is a series of questions that is the first thing that you will access once you click and open the application. And in order to qualify to advance in the application process, organizations must first be headquartered and work within the United States, Puerto Rico, or other territories of the United States. They must hold a 501c3 tax-exempt certification, or be a fiscally sponsored organization of one that holds a 501c3 status. They must be Latine-led and Latine-serving. And according to our grant-making board, we define Latine-led as organizations where Latina leaders are in a position of influence within an organization, meaning 51% of the board and staff identify as Latina. And for organizations to be Latina serving, organizations must be committed to serving and empowering Latina communities through their programmatic services that are directly focused on the needs of Latina communities and that can demonstrate a history of working and serving these communities. Organizations must also have a budget of under $750,000 in order to be deemed eligible for any of these funding opportunities. Once an organization has gone through the eligibility screening, there are going to be several pieces of information they'll need to provide as part of the application. The first is going through a series of questions within our proposal narrative. They'll also need to prepare an annual operating budget, provide a list of their board of directors. If your organization is fiscally sponsored or does not have its own traditional board of directors, you can provide a list of your fiscally sponsored organization's board of directors. An organization must provide its most recent financial audit or Form 990 that's been submitted to the IRS. If an organization does not have either, it can provide us with a letter just explaining the reason why it doesn't have that kind of documentation to supply. We recognize that not every organization is required to submit this because they may not reach the threshold that's required by the IRS to do that level of reporting. And many organizations may be in their first year and haven't had to undergo that process. We'll also request a project budget. This isn't to hold organizations to account to what they're going to be spending, because these are general operating dollars, but rather to give us a sense of what you're thinking about, so that if you are awarded funding, you can work directly with our team, and we may be able to help you in determining other avenues where you can better allocate your resources to support sustainability or to support the programmatic work that you're doing. We'll need a representation table because we want to understand who is a part of your organization's leadership and its decision-making, because we really want to support organizations that are representative of the communities that they're working with. Your fiscally sponsored organization, you'll need to provide us with a copy of your fiscal sponsorship agreement. And if you'd like, as an optional attachment, organizations are welcome to attach any memorandum of understandings that they may have, or letters of support from other partners who can further speak to the impact or the collaborative work that they've been doing in the areas that they're serving. Within the proposal narrative itself, the application has 3 core elements that organizations will want to focus on, 3 sections. The first is the broad organizational overview, and we'll go over the specific questions in that section in a moment. You'll also want to provide some budgetary information, and then we'll dive deep into the narrative questions themselves. And you can reference pages 17 through 25 in the RFP online for additional information about what these questions are asking. Within the organizational information section, we'll want some general background about your organization, including the year it was formed, what its mission is, where it is, when it began engaging in HIV-related work. We'll want to have some contact information for the primary contact of this grant opportunity. We'll want a sense of the leadership composition of the organization. We'll want a sense of the priority communities that this organization is serving. We also want a sense of the geographic focus. Is your organization's reach in rural communities? Is it statewide? Do you have a regional focus? Do you reach nationwide? And an explanation of some of the programs and services that your organization has provided and will provide to communities that it's working with. Within the budget information, we want a sense of what your current operating budget is. You'll be able to self-identify which of the 2 funding tracks that you'd like to seek based on which of the 2 areas, based on which of the 2 tracks your organization is eligible to apply for. You'll want to provide us with a proposed budget. And one thing to consider that we don't actively ask, but something that you want to consider in your proposal is what percentage of your budget this grant represent. Now, traditionally, we don't want this grant to represent, almost half or a larger share of your organization's budget, because then that calls into question areas of sustainability. But we do believe that in working with organizations with smaller budgets, we can support them in best identifying other funding streams throughout the grant process or even the application process that may support them in the long term, even if they aren't the best fit for this funding opportunity, or if they end up receiving funding from this, we'll provide long-term technical assistance and capacity building support to help them identify additional resources. Narrative questions range for the application process. First is a statement of need. We want to understand what is happening in your communities. How has the epidemic impacted the lives of the folks that you live, work, and play alongside? Number 1, a description of the work and impact that your organization has been able to provide to this point. And again, for organizations that may not have a long history in working in the HIV space, this is where you can speak to how you hope to bridge your work in the HIV field from some of the broader social justice initiatives and efforts that you may be engaging in. I want to sense the funded activities that this program will support. Again, these are general operating dollars, and so if your organization proposes a specific plan and is a recipient of funding and needs to shift due to external circumstances. We all live in challenging times, and we recognize that our organizations must be nimble and pivot to respond to the moment. That's totally fine. We're not holding organizations to the things that they've explained in their proposal to 100% certainty, because again, we understand that there may be needs for organizations to pivot in response to external or environmental factors. We ask questions relevant to an organization's commitment to racial justice and health equity, and to help us explain how you see those two things as interconnected and how they show up in your work. Because we're working with communities that have a storied history around having their data shared with institutions and have a series of mistrust with medical institutions themselves, we want to ensure that whatever organizations are proposing in their work, they have a plan to be able to secure the confidentiality and privacy of any of the information that they collect from the communities that they're working with. And so part of the narrative is going to ask questions around what your plan for securing that information is. A demonstration of what meaningful involvement will look like. We believe that it is paramount for organizations to engage communities who are disproportionately affected by and those that are being served by their organizations to be involved in decision making. And so this question will allow you to expound upon what your approach to that effort is. How you seek to evaluate the impact of your work is also another critical question. And then finally, a question around sustainability. We recognize that these are multi-year funds, and so what you may plan around sustainability in year one may be different based on what may happen in years 2 and 3, but it just gives us a better sense of what you may be thinking about and also how we may be able to tailor some support over the course of the 3 years to best support your organizations in achieving those sustainability plans. And again, you can reference pages 17 through 25 in the RFP for additional information. Now, as I noted it earlier in the presentation, we do provide general operating support for organizations to have the flexibility to achieve their mission and to serve their communities while prioritizing one of the 4 funding areas that the Conexiones Positivas Fund has named as its strategic approach to addressing the epidemic. Those include advancements in health equity, commitments to and engaging in grassroots organizing and movement building, promoting and engaging in media and narrative change, and investing in the next generation of leaders and your organization's infrastructure by committing to leadership development and capacity building. And you can cite pages 5 and 6 in the RFP for examples of how we define each of these 4 areas. Now, for those that are going to begin the application process, we encourage you to draft your narrative responses in a separate document, a Word or Google document, so that you can use all of the tools and features that are available within those word processing tools, like spell check. You can use the word counter so that you can see exactly how much information you're sharing. You can structure and format your responses in a way that best serves the way that you want to deliver that information. That said, we don't have word counts on any of the responses. Feel free to be as robust as you would like or as concise as you would like. We're leaving that up to you. But definitely encourage you to keep a separate copy of that information on hand. When you do submit the proposal, you will receive a copy of your application by email as confirmation. But again, always best to have some of that information set aside, because you never know, some foundations may ask you to just submit proposals that you've used with other funders in lieu of submitting an application through their own process. And as a hint, that's something that we're exploring in the future. We encourage organizations, while we know that there's a few weeks left within the application period, do not want you to rush. You can take your time. There is part of our application process allows you to save your progress and then allows you to resume later on. All you need to do is enter an email address and create a custom password, and it will send you a notification via email so that you can pick up the application at any time. This is also a helpful tool to use if there are multiple people involved in helping to prepare your application. For example, there may be one member of your team that can report on the finances, another person who may be able to contribute to select responses in the narrative portion of the application, another who may be able to provide the attachments. So again, just thinking about how you can best leverage multiple members of your team or other folks who can invest in your application process. And finally, do not be afraid to reach out and ask questions about the application itself, the questions that are within the application, or to utilize the office hours that are available to support organizations as they go through the application process. Now, speaking of the application process, we do have an alternate application that is available for organizations that are not able to submit their responses in using the traditional application form. And this alternate application is a 30-minute interview with one of the members of our Conexiones Positivas staff, where organizations will be responding to the narrative questions. Now, if an organization would like to take advantage of this alternate application, they simply need to reach out to our team with the email address cppc@aidsunited.org and have in the subject line Conexiones Positivas alternate application. In order to be eligible for submitting this alternate application, this request must come to our team no later than Monday, November 25th. This will allow adequate time for our team to schedule a meeting with your organization representative to go over the narrative questions and to capture the responses so that they can be used in the review process. Organizations can also request office hours for some assistance in completing the application. These 30-minute slots allow applicants some dedicated time to meet with a member of our team to discuss any and all questions they have about the application process, about their initiative, or the things that they're proposing in the application itself. Our team is happy to provide you with feedback on how your proposed projects can be more responsive to the priorities that have been outlined within the funding opportunities. If you want a set of eyes to take a look at your application and to give you feedback, if you're stuck on a particular question and you want to tease out an idea, or if you're not sure exactly what is being asked in a particular question, our team is more than happy to meet with you and go over that information. You can reference page 13 in the RFP for more information about the technical assistance that's offered through the grant application process. To go over our timeline, our grant opportunities have opened as of November 1st. We are in our second of 2 webinars to provide application assistance, the first being on November 13th, and the second being today, November 16th. And these webinars are recorded and will be made available on the AIDS United website by mid next week for any organizations or any peers within your organizations that may be interested in seeking additional information or becoming familiar with the application process. Our applications close on December 2nd, and organizations will be notified of their funding of their award in January of 2025. Between December 2nd and January, we will be convening an external advisory committee who will be responsible for reviewing the applications and providing feedback and determining which of the organizations they recommend for funding. This external advisory committee is comprised of individuals in the community who have been engaging in this work for a number of years, who represent the vast diversity of Latina communities living with and affected by HIV. These are area experts. These are folks of lived experience. These are folks who have academic background in this work, who have an organizing background, who have dutifully invested in public health from different dimensions of their work for many, many years. And so, who better to be able to provide feedback on the work of organizations than individuals who have worked within these kinds of institutions and have been recipients of these kinds of services before. And finally, in February of 2025, we will have a kickoff webinar to welcome our new grantees. And the grant period will run again for 12 months, and organizations will be able to renew for funding each year. The renewal process is going to be fairly simple. Don't worry, you're not going to have to submit a brand new application each year. Now, finally, if you have any questions about this funding opportunity that extend beyond today's webinar, you are always welcome to reach out to our team at cppc@aidsunited.org. We're more than happy to answer all of the questions that you have relevant to this funding opportunity, relevant to your eligibility. If there are specific areas within the application that you'd like to discuss and meet to go over, again, our team is more than happy to meet with you. And if you encounter any specific technical issues with the application itself, let's say for one reason or another, the web link is no longer working or the submission button has disappeared, you can contact our grants team at grants@aidsunited.org, and they're more than happy to resolve any of those specific technical issues that may be coming up with the application itself. Let's say you started the application, for whatever reason, it wasn't saved, our grants team may be able to recover any of that information that had been lost. But again, I encourage you to reach out to them if you're experiencing any technical issues with the application itself. Now, with that said, I am going to go over the application with the folks on this call together so that we can walk through the funding opportunities through both the Caminos and Desarrollo funds. Now, as you see on the screen, the first page of the application itself is our application screener. There are a series of questions that you'll need to respond to determine eligibility for your organization, and the criteria for eligibility are the first thing that you'll see at the top of the page. There's a series of, I believe, 6 questions that you'll respond to, either yes or no, quick responses. There's a link to provide you with a bit more context around what our framework for meaningful involvement has looked like. And if your organization is eligible to advance to the application process, then you will be directed to our application. If your organization does not meet the eligibility requirements, there will be a message provided there and some additional information about other funding opportunities that may be applicable to your organization based on the responses that you've provided. Now, if your organization is eligible for funding, you will be directed to the application itself. The top of the page provides some general guidance on how to save your application in the event that you would like to start and stop at a later time. You will then provide some general information about the funding opportunity, your organization's information, its EIN. If you're a fiscally sponsored organization, you'll check this field and you'll be asked to provide information about your fiscal sponsor. If you're working in collaboration with partner organizations, there's a separate section at the very bottom of the application that just asks you to describe a little bit more about what that partnership may look like. Year founded and beginning to work in the HIV sector. Some primary contact information about the point of contact for the funding opportunity, as I mentioned, some information about the organizational leadership of your organization, so we can have a better sense of who's at the decision-making table. Questions relevant to your organization's budget, including the start and end of your budget year and the actual organizational budget itself. Questions related to conflict of interest. And then here's where you'll select the grant opportunity based on which of the 2 criteria your organization is eligible for. You'll provide us with a description of the groups that you seek to reach with your funded activities. And if there are more than one category of individuals that you are seeking to reach through your work, all you need to do is select add another target group. You'll be able to list as many individual communities that your funded opportunity seeks to reach. You'll provide us with a breakdown of the geographies that your work is reaching, whether it's in urban or working in rural communities, if it's statewide or national, and then just a general description of what these locations are or look like. Let's say you are a regional organization that serves 4 primary states in the Deep South. Here's where you would list those 4 states that you're operating in. If you're working in an urban community that's hyperlocal, here's where you would list the name of the city that you're working with. You'll provide us with a breakdown of the types of services that your organization provides. We have a couple of categories here, and you can select more than one of those services if your organization provides multiple services. And then here's where you'll provide the responses to the application narratives. As I said, we'll go over the statement of need, providing us with some context around what's happening in your community and how the HIV epidemic is impacting those in your community. Bit of an organizational overview to explain some of the impact and the work that has taken place thus far under your leadership. Describe how you seek to use these funds to support your work, what your overall evaluation plan is to support the work and to support the data collection, what your commitment and how you apply strategies for health equity and social justice broadly, what your demonstration of meaningful involvement is, how you plan to maintain the security and confidentiality of the information of your clients, patients, and community members. If there are certain areas of our reporting that you are seeking exemptions for one reason or another, simply just describe that. Or if you don't have any requests on exemptions, you can just put not applicable. And then if there are any specific capacity building needs that you anticipate for the course of the grant, for example, assistance with grant writing, assistance with mass communication, assistance with board development, you can list those out. These will not have any impact on the evaluation of your application. This simply gives us a sense of the kind of information that we can prepare in advance should your organization be approved for funding, so that we can make sure that we have everything that's needed to support you and your organization to thrive throughout the grant period. You'll identify which of the funding priorities your organization best aligns with, and then provide all the attachments that we discussed earlier on in the presentation. You'll hit submit. You'll be asked to review your application one last time to ensure that all of the responses that you wanted to provide are there, all of the attachments that you wanted to include are there, and then you can finally hit submit one more time, and you will have sent your application into our team. You'll receive a confirmation email, and you'll know that your proposal has been received by the team and will be under review throughout the course of January. I believe that's everything that we can cover at the time. If you have any questions, as I said, feel free to reach out to our team at cppc@aidsunited.org. Thank you so much for your time, and best of luck in the application process.